My name is Raney, and I got a bachelor's of biochemistry in 1987. I completed my medical doctorate at Baylor College of Medicine in Houston in 1991. I did 2 years of general surgery and then 4 years of head and neck surgery at Baylor College of Medicine, finishing there in 97. And I joined a group called Texas ENT Specialists at that point. I've been with that group for 27 years now, and I've served on various committees. I served as the president of the group from about 2010 until about 2013, and then became involved with Elevate ENT Partners in 2020. We've had a growing relationship with them since 2021. What Elevate brings to the table for any of their partners is a really sophisticated suite of managers. The physicians will always say that what they want to do is focus on patient care and taking care of their patients and not have to do this other stuff. It's impossible to escape completely because it's your responsibility, it's your practice. But Elevate really does come in and solve for a lot of the problems that you have on a day-to-day, month-to-month basis and help you through those things with a very professional staff. They take the lion's share of that off the plate of the doctors, allowing you to focus more on your practice, and yet having some input into how the practice is run because it's really a physician-led practice. I think the management challenges in ENT in some ways are no different than they are for any other medical practice. But what it really amounts to is you're the manager, you're all of it, unless you have a really professional management team. And what that looks like day to day for most people is the EHR malfunctions. They've got to call an IT person who is a contract person who may be able to come in day after tomorrow. At the same time that they're trying to see all of their patients, their phone system malfunctions. They find out that their audiologist is going on leave. Now they become a hiring manager. They go to the operating room the next day and they're getting a call saying that there's a new credentialing package that's necessary for a facility that hasn't been done yet. So now you're your own credentialing person. So you really just end up taking on all of these functions yourself unless you get a super strong management team that can help you with that. If you don't plan on joining a big group, you need to find a group purchasing organization. I think you should do what you can to avoid becoming a W-2 employee of a hospital or an insurance company. Now, if people are open to the idea of joining a big group and growing their practice, maybe even becoming part of a group that's a multi-state entity, then something like Elevate's a great solution for you. Other practices should consider joining Elevate ENT if they want to be part of a growing practice that has strong ancillaries, that has strong management, that has a partner that has the resources to help you grow and become more professional in all aspects of your practice. So one might ask why everyone hasn't joined Elevate ENT or a similar organization. And what I would say is you don't really know what you're missing. I think as the old joke goes, the frog is being boiled slowly. The temperature is being gradually turned up. You don't realize that you're about to be cooked. But if you look at the numbers, what's really happened to all physicians over the last 25 years is our fee structures have eroded from between 20 and 35% in inflation-adjusted dollars. Simultaneously, our documentation burden has gone way up. We're spending probably an extra 5 hours a day, believe it or not, in documentation time over what we would have spent 20 to 25 years ago. And we all know that a lot of that's happening after dinner, robbing you of your time with your family, your time to relax, your time to pursue other goals. And so it's this slow motion burnout that I think is driving physicians to look for partnerships that can allow them to get back to their knitting, back to medicine, and still prosper.